in J&K. The prevalence of tobacco use is high in J&K. Almost 20% adults are doing it, which means that almost 70% households are exposed to tobacco and allied smoke and other ill effects.
We have added a number of medical colleges to spread the medical education, and in fact in the last 5 years or so we have added 7 new medical colleges. Beside that, 2 new aims are coming up. In fact, this year itself we have started the first batch of MBBS students in GMC Udhampur and GMC Handwara, and that takes our intake capacity of MBBS to 1300 a year, which is almost like 2.5 times compared to our capacities 5 years ago.
And our objective is that no one should need to go outside J&K for whatever treatment, so we are really working at it.
Hello and welcome to this episode of Beyond the Headlines. I'm your host Nazir Ganai. Jammu and Kashmir has witnessed a tremendous change on ground as far as the health sector is concerned. We have with us advisor to LG, Dr. Rajeev Batnagar. We have with us Secretary Health and Medical Education, and we are going to speak about the healthcare scenario in Jammu and Kashmir. So starting from you, what is the overall healthcare scenario in Jammu and Kashmir?
If you were to look at the health services and some of the indicators, we have really improved on a lot of aspects. If you were to look at right from the PHC level up to the tertiary care level, a lot of expansion has taken place and we have put in a lot of new facilities, and our effort is both in prevention as well as in treatment, and we are taking the health services right up to the doorstep. Today our effort was to look at what can we do about the prevalence of tobacco in J&K. The prevalence of tobacco use is high in J&K. Almost 20% adults are doing it, which means that almost 70% households are exposed to tobacco and allied smoke and other ill effects. Even workplaces it is as high as 60%. So today's effort was to bring in all the stakeholders together and include the media, as we know that tobacco is also, it is the cause of the most preventable diseases which cause death. So it has a very high healthcare cost and a very high cost to the society, to the family, apart from the personal loss to the family. Also, it is the gateway to other addictions. It is well established that a person who tinges for tobacco is likely to also take alcohol, become an alcoholic, or start using other narcotic substances like cannabis and others. And it is very, very important that we have to get this message across to the young ones, because they are the ones who are most susceptible because of the peer pressure, different reasons. Also here the legacy of their elders smoking. So we have to really get the message across to them very early and tell them the ill effects of tobacco use, which would be on their health. It could be also on their psychological build-up, on their tendency to fall prey to other addictions, in terms of losing their stamina, in terms of hindering their performance in sports and other activities. So I think today is a very, very important effort done by the Health and Medical Education Department, and especially interacting with the media, so that we are able to take up this cause in a holistic manner, and with the help of all our stakeholders, be able to effectively get the message across and be able to make a dent in the behavior of the common person.
Jammu and Kashmir is also considered as the smoking capital of India, so which is not a good thing. I mean, and at the same time, these products are readily available. You will mostly find them maybe outside schools. You will mostly find them readily available when you go along these roads and lanes and bylanes. What is government doing on this, especially health and medical education department? Is are they going to take any stringent action against it?
See, we have been focusing on it. I agree with you that these regulations need to be enforced strictly. And the good thing that I found was that compared to last year, in just the first 8 months, we have done the fine has almost 10 times. So I think the realization has come that we need to enforce all these regulations which are regarding the no tobacco zones, the distance from schools where no sale is permitted, also the sale of cigarettes, loose cigarettes. That is another issue that we need to address. We are also looking at the aspects of tobacco vendor licensing, and so like I said, that it is in a holistic way we have to address this. We have to look at the legal framework, we have to look at the enforcement, we have to look at also involvement of all persons in the society, all the opinion makers, and also today the social media is so important. So we would like to use all influencers to get this message across. And like you said, the problem is something which is very significant for JNK.
Bhupinder, Batnagar Sahib has given a holistic picture about this whole issue and how government is taking steps to actually curb this menace. Could you please tell us, since you joined the department, and there have been a lot of initiatives that you have taken on ground to actually revamp the healthcare sector, what is the current status of how many new hospitals are coming up, and what is the healthcare scenario of Jammu and Kashmir?
See, talking of J&K, I think J&K is one of the few UTs and states which have been able to actually meet the targets of health spending, whether it is as part of our gross domestic production or the budget. In fact, we are one of the forefronts in terms of per capita investment in health, and it is in this regard that our indicators are also now a proof of that the government has been very serious in terms of investments in sector. We have added a number of medical colleges to spread medical education, and in fact in the last 5 years or so we have added 7 new medical colleges. Beside that, 2 new AIMS are coming up. In fact, this year itself we have started the first batch of MBBS students in GMC Udhampur and GMC Handwara, and that takes our intake capacity of MBBS to 1300 a year, which is almost like 2.5 times compared to our capacities 5 years ago. Secondly, we have also been focusing on the training of postgraduates. We have nearly 950 PG seats in various medical colleges. Also, we have made strides in the direction of making our district hospitals a teaching hospital. We introduced a DNB program, and in fact, we have added around 300 odd seats to our kitty by bringing these district hospitals and even sub-district hospitals as teaching hospitals. And this has in fact improved the availability of HR in remote areas. And in fact, I'm very happy when I say that the first batch of our DNB students who passed out this year from our district hospital, they qualified the exit exam of DNB, which is a credible proof that the quality of teaching, also our mentorship in our district hospitals, is improving. And of course, it has its added advantage, that is availability of human resource around the clock. And we are again focusing on further adding to these efforts. Secondly, in terms of our nursing colleges, we are now aiming to set up new nursing colleges. In fact, the last 1 year or so, we have started 4 new nursing colleges. So our focus is on the medical education, so that our availability of human resource in the future is there, and that will be a very, very important factor in terms of attracting private investments also. because human resource is the most critical element of healthcare, as we understand. Coming to health, as you know, we are running our own programs. We have got a lot of support from Government of India also in terms of National Health Mission and various central sponsored schemes. Now, with the change in disease profile, as we observe, our focus has now shifted on the non-communicable diseases, and we, as we understand, the disease burden of non-communicable disease is very high, and they're the biggest killers, as we know. So they also contribute a huge cost on the government, on the individual, on the society as such. And the idea is to detect cases of hypertension or diabetes or cancers at an early stage, to make efforts towards preventive health and promotive health. And that is why we have really revived our health and wellness centers, which were initially largely confining their activities to the immunization program. But now the primary healthcare has been revamped. Efforts have been made in that direction in terms of availability of HR, and also the range of activities which a sub-center now performs has certainly gone up. It has become more comprehensive now, and our efforts are only in the direction of building the capacity of our own human resource in terms of their capacities to detect at an early stage, to spread awareness on disease prevention, and then of course providing continuum of care. Not only do we detect somebody, but also ensuring that the person adopts the treatment which is prescribed by the relevant or qualified doctor, and he continues to adhere to that. And what we have seen in terms of in the NCDs is that a lot of people do not adhere to the treatment, so which leads to premature morbidity and premature deaths also. So our efforts are on those directions.
Do you do the audits regularly?
See, that's in fact, as we know that nearly 2/3 of deaths that take place, they are attributed to NCDs. So what we have now started doing is something called population-based screening. So all population which is 30 years and above, our teams in the field will proactively screen them, and that they'll do year after year, so that a healthy awareness generation. I mean, of course, people should be made aware. They should develop a better health seeking behavior. That is also a part and parcel of what we do. So we are in the direction of screening, then quality of screening, whether those who are screened appropriately or not, and then those who are screened and detected to be there with some condition, are they provided the right kind of treatment? And then of course building our capacity in terms of easy availability of diagnostic facilities in our peripheral hospitals or the primary
See, one point I would like to add is the new Ayushman Bhava program that has been started, and that is going to, through health camps, identify these people, and we have made a plan for follow-up of all these. Also, another very significant thing that has taken place is that we are among the first to have universal health coverage.
Yes.
Every person in J&K has an health insurance of 5 lakhs a year. So his capability to be able to take the treatment has really made a big difference. The other thing is that in terms of specializations, we are coming up with 2 specialized cancer hospitals, apart from the institutions he had mentioned. So we are looking, and we are also looking at alternate and integrative systems of medicine also to help us in this, because most of these are lifestyle diseases, and we find that the role of the alternate and the integrative systems of medicines is also tremendous in terms of. So I think we are looking at things very holistically, and it is. I would also like to congratulate the State Health Authority, which got the Best State Health Authority Award just last week from the Honorable Union Health Minister. So I think we are committed. We are utilizing, like he said, the resources in a best possible manner, and looking at how to create the specialized manpower that would be required to give the kind of specialist services that we would like to give. And our objective is that no one should need to go outside J&K for whatever treatment. So we are really working at it.
There's a lot of mushrooming of these nursing homes. How is health department, especially the government, keeping an eye on that?
See, if you were to look at J&K compared to other places, here the government sector provides the bulk of the services. So we are also looking at if we can get big players from the private side to add to the services. That would also augment the whole bouquet that is being offered here. But our objective is that we, the government sector, should be able to offer everything, right from the primary up to the last tertiary care. And we have started a lot of new things. We have started with kidney transplants,
Transplant programs.
and we are soon going to start liver transplants also. So we are looking at all the high-end procedures which were not here.
Are we seeing any big player coming in the private sector very soon?
So this year itself, in fact, we have got two interested parties who have started, setting up medical colleges in Srinagar. I mean, in and around Srinagar. In fact, one of it is going to be a 1,000 bedded facility, and another one is going to be a 500 bedded facility. And apart from that, we'll have the medical colleges also, which will be up and running. And the government has, under the industrial policy, allotted them suitable land also. In fact, they started working on it also. And as I said, the investment policy by the industries department is also supporting investment in health. And as we so it the conducive environment that is being provided the overall basis, if I say so, getting two private colleges for investment, it's a big step towards investing more attracting investments in healthcare. And I'm sure, as I mentioned, that our conditions are far more conducive. And in terms of HR, in fact, HR continues to be the big, most difficult component to manage at any place. There are other places in other parts of the country where people are unable to set up a hospital or medical because they don't find adequate manpower. And the investments that have been made in medical education will actually bear the fruit in the days to come, and you will find a lot more people interested in coming and investing in this part.
The ban on private practice of government doctors is a big issue that has been discussed over the years. And I think with the change of the regime, a lot of initiatives were taken. A lot of doctors were also shunted out because they did not join their duties and all. What is government's stand on ban on private practice of government doctors?
You see, we are looking at things holistically. We are making sure that a government doctor has to do his duty in the right manner and spirit, and also in terms of the time that he needs to devote. So we are looking at other aspects also, like you mentioned, private practice and others. But our first objective right now is to make sure that the government health sector delivers, and every personnel who is a part of it does his job.
So lastly, why do you figure Jammu and Kashmir in healthcare scenario?
We are doing very well, and we would like to be number one.
Thank you so much, sir. Thank you so much for your time.
Thank you.
It was wonderful interaction, sir.